My name is Bethany Chef. I understand you're going to be having spinal fusion. I had mine 6 months ago. I had a lot of questions, but the doctor explained to me what a spinal fusion was and how he was going to do it.
These x-rays here show how large the curves have become, and they're past the point where bracing would be effective, even in trying to buy you some time before you have to have surgery. When a curve has reached this
At first, he showed me an x-ray of my spine.
to an individual like yourself, with you sound asleep, lying prone or face down on a padded frame, and with everything cleansed and draped, we'd then make a straight incision down the entire length of the spine that needs to be fused.
Then he showed me an x-ray of a patient who had this kind of surgery to show what it was like.
B, I'd like to show you some films of a patient who had a curve pattern similar to yours, who's already had this type of surgery. And you can see that there are several hooks in a complicated arrangement. Here on the left side alone we have 1, 2, 3, 4, 5, 6 hooks.
The surgeons expose the back part of my spine. They insert rods along the spine. After the rods had been placed, they put a bone graft into the area. It grows and fuses the spine. The rods support the spine while the fusion is becoming solid.
The crucial thing that we want to achieve here is balance and stabilization. In other words, we want to make it so that your curve, like his, will not keep increasing with time.
When they are all done, staples or sutures will be used to hold your skin together for the incision to heal.
So B, in summation, this would be about what your spine would look like after surgery if everything goes well, with the fusion, the rods, and the hooks, with the fusion being the extremely important aspect of all of this. And that will take about a year.
Jana, one of the nurses, was great. She filled in all the gaps. I wasn't really sure that I wanted to have rods in my back. What about after surgery? Can my parents be there?
Yes, your parents can visit you after surgery. You'll be a little bit groggy, but you'll know they're there. And if you'd like, one of your family members can stay with you in your room.
How long do I have to stay here?
You'll be in the hospital until your staples are out and you're able to be up.
What about school? I'll get so far behind.
Okay. Yeah, page 159, 1 through 6.
You can work on your studies while you're here, and you can contact your teachers by phone. And if you get too far behind, when you go home, you can arrange to have a tutor until you feel well enough to go back to school.
Okay.
How do I go to sleep and wake up after surgery?
Well, your anesthesiologist will come in and answer those questions for you before your surgery.
Hello, Bethany. I'm Dr. Bindler.
Hi.
I'll be your anesthesiologist tomorrow. I'll take care of you during your operation, and we'll be putting you to sleep with a general anesthetic, so you won't be aware of anything that's happening to you during the operation, okay? Do you have any questions?
How will I wake up?
We'll stop giving you the anesthesia medications, and that will cause you to wake up.
You probably have many more questions about your surgery. I did. Was I going to have any pain? I did have some pain afterwards, but the nurses gave me some medication, and that really helped. Don't be afraid to tell your nurse if you hurt. Some people get an upset stomach afterwards, and the nurse can give you some medication for that, too. Well, what do you think? This is what your room will look like. It's not exactly like home, but it's okay for a while. The time before surgery is called pre-op. And during this time, there are a lot of things that need to be done.
We'll do the right leg?
Yes.
Okay.
There is a test called the evoked potential. You have to lay still for 1 to 2 hours while your muscles and nerves are tested.
And you can see your feet are twitching.
I listened to music with my headphones so it wouldn't be so boring.
Relax your hand.
The nurse will need to take a blood sample for the lab, and you'll be asked to give a urine sample. You will probably have some x-rays taken and maybe even an EKG. That tells what your heart is doing. After you get settled, you will be asked to wear a hospital gown. It isn't that good looking, and it doesn't cover you very well, but it isn't all that bad.
Okay, Bethany, I'm gonna have to take your jewelry from you now.
Before your surgery, you will need to remove any makeup, jewelry, nail polish, contact lenses, or dental devices, or retainers.
Okay. Do you wear any contacts? How about any dental devices? Do you have a retainer? No? Okay, well, let me give you this name band. There we go.
This is an IV or intravenous pump. This pump regulates how much fluid or medicine you get. A small tube will be placed in your arm. You may have more than one IV line in your arm or neck. The fluid goes down through the tube into your vein. You'll hear this sound sometimes when you're connected to it. That noise alerts the nurse to check your IV. Situations aren't as frightening when your questions are answered, so ask questions. You won't be able to eat after midnight on the night before your surgery. That's what the NPO sign means.
Bethany, I need to check your name band here. I got a pre-op medication. This might make you a little drowsy.
Before your surgery, you will be given some medication that will make you sleepy. Once the medication is given, you will be asked to stay in bed. This is when you will have to begin using your call light if you need anything.
Your blood pressure and your pulse here. You know how to do this, don't you?
After the medication is given, expect your vital signs to be taken quite often. Your nurse will be checking your pulse, respirations, and blood pressure. Once everyone is ready, including you, you will be transported to surgery on a stretcher. Just lay back and try to relax. You may feel groggy and sleepy as a result of the pre-op medications.
Off we go. That does too.
Your family will be waiting for you in the family waiting room. It is close by so they can see you soon after surgery. This is the pre-op holding room.
Good morning, Bethany. I'm Krisha. I'm your pre-op nurse. You're in pre-op holding right now. We're going to go ahead and take your vital signs and hook up an oximeter on your finger, and that's going to tell us your oxygen rate. And then we're going to go ahead and transfer you over to this other room, and your anesthesiologist and your doctor will be with you in just a minute. And I'm going to have to go ahead and...
There will be a lot of people in this room. All of them are going to help to take care of you during your surgery. Operating personnel are dressed differently than those on your hospital floor. They will all be wearing clothes called scrubs with foot covers, masks, and hats. We are now on our way to the operating room. It will be a little bit chilly, so they'll have warm blankets for you if you like.
Hi, Bethany. You're in the operating room now. We're going to go ahead and ask you to help us move you over to the operating table now from the gurney.
There will be several people in masks and gowns in the operating room to help the doctor with your surgery. There is a lot of special equipment in the operating room: spotlights, instruments, and a special table. This special bed is for performing back surgeries. Once you go to sleep, the nurses will transfer you to this table and you'll be positioned comfortably.
Hello, Bethany. I'm Dr. Bindler. I'm the anesthesiologist, and I met you yesterday. This is the anesthesia machine behind me, and it lets us measure your heart rate, the amount of oxygen in your blood pressure. It also lets us deliver the right amount of medication to keep you asleep all during the operation. This is an oxygen mask, and I'd like you to start to take some nice deep breaths.
Bethany, your surgery's over. How are you feeling?
Tired.
Tired? You in pain?
The next thing you will remember is waking up in the recovery room.
I'm going to go ahead and listen to your lungs. Okay, and you've got some equipment hooked up to you that's doing some beeping, okay? There's nothing wrong. That's just part of the recovery room, all right?
The recovery room is located next to the surgery department and is under the direction of the doctor of anesthesiology. This is an oximeter attached to your index finger. A bright red light is on. The monitor hooks up to a machine which measures the amount of oxygen in your blood. This is a blood pressure cuff. Every 15 minutes, it will monitor your blood pressure. It squeezes your arm, takes your blood pressure, then relaxes.
Can you do me a favor, hon, and try to wiggle your toes? That's really good.
The nurse will ask you to wiggle your fingers and toes and ask if you can feel them. The nurse will count your respirations, listen to your lungs and abdomen. You will get medications through your IV if you have pain or feel sick to your stomach. Your throat may be sore from the tube placed there to help you breathe during your surgery.
Bethany, we're going to go ahead and take you back to your room now, okay?
Once you are fully awake and all your assessments are fine, you will be moved by a stretcher back to your room and lifted into your bed. The nurses will continue to do assessments of your vital signs, IV, catheter, and dressings. You won't be eating regular meals for several days after your operation. Until then, your IV gives you the fluids you need. When your stomach is ready, you'll start with ice chips, then have something to drink and gradually start eating soft foods like Jell-O and pudding. Don't hesitate to ask for help. Use your call light if you need anything. At first, you will not urinate on your own. A small tube called a catheter is used to carry the urine out of your body and into a collection bag. It will be removed in a few days. After that, a bedpan is used, and if you're a guy and you have to urinate, a urinal can be used.
Okay, Bethany, we're going to turn you. I need you to cross your arms.
For the first 8 hours after surgery, some patients must remain on their back. Then a procedure called the log roll will be done every 2 hours. This helps to keep you comfortable and prevents damage to your skin.
How's that? Are you comfortable?
Remember those staples or sutures that are put on after surgery? They need special attention.
Okay, Bethany, I need to look at your staples.
You will be helped to roll over carefully. The incision will be checked and a new dressing may be put on. If you have staples, after several days they will be removed.
Looks like those staples are ready to come out, maybe tomorrow.
Will it hurt?
There might be a little bit of discomfort, but it shouldn't hurt too bad.
They told me I would have some discomfort after my operation. They were right. I knew it was coming, and that's what helped me deal with it. They told me to press my call light whenever I felt uncomfortable, so I did.
Can I help you?
A nurse came, and I told her how I ached and asked if there was anything she could do.
How about if I have you push your pain button and then we'll reposition you?
I was able to give my own medication with a machine called the PCA pump. It worked well. All I had to do was press a button when I was feeling pain, and it would give a dose of medication through a tube into my arm. Of course, the machine was set so it could not give me too much medicine. I was log rolled on my side to make me more comfortable.
Okay, on the count of 3. Ready? 1, 2, 3.
I need you to take 5 deep breaths for me.
Okay.
Okay?
You will be asked to breathe into a special device called an incentive spirometer. You breathe in as deep as you can for 5 times and then cough. The nurse records how much you breathe in.
Great. All right, now I need you to cough for me. Okay?
You have to cough to get out mucus from your lungs. This keeps you from getting an infection in your lungs.
Good.
Eventually, I was up and getting pretty good at walking around. My nurse told me I would be going home soon. I could hardly wait.
Good job, Beth. You're doing great.
I wanted to get back to my friends and family. My doctor told me I would wear something called AP shells. They're to help support your back for several months after surgery. I wondered what kind of clothes I could wear with my shells on. Most everything seemed to work well, but vests and hooded tops work the best. I'm wearing my shells right now. Can you tell? I have to wear my shells 23 hours a day for 1 year. And I probably shouldn't do PE for a long time, like a couple of years. And I can never go bungee jumping or skydiving. Oh, darn. But in the summer, I'll be able to go swimming. And your doctor will tell you what is best for you and at what time you can do that.